Hi everyone, my name is Dr. Sam Dassanayake, Ayurvedic doctor practicing in Melbourne. Today I would like to present you the Ayurvedic segments, and we will be discussing about lower back pain. Now lower back pain is a very common musculoskeletal issue that is prevalent among all age groups. Now if you are above the age of 55 and over, then you are most likely to face a degenerative issue. So that means the cartilage in between the vertebrae of L4, lumbar 4 and lumbar 5 can have degenerative in nature and can pinch the sciatic nerve. So that is one way of having the lower back pain. It could be radiating through your buttocks, through the sides to the lower limbs. Now the second one is the most common one among young crowd is the bad posture, because these days most people are working from home, and if you don't take time to stretch yourself and make sure that circulation is restored, then you could have a lower back pain. And so that is among the young crowd. The other one is also prevalent among the younger generation. If you are lifting weights, if you are in stocking, in warehouse and repetitively doing things, then that's the repetitive strain injury. So you have to make sure that you follow proper ergonomics, office ergonomics. If you are lifting, you have to lift from your knees and not from your back. And so these I think are the most prevalent issues where someone can get lower back pain. Now if you have a muscular tension, so which means if you sprain, if you are trying to lift something and all of a sudden you get a pain, please rest, and whatever the Ayurvedic oil that you have at home, whether it is Narayana, Shulahara, Sarshapadi, just apply some, put some heat, and if it dissipates and you feel better, that's fine, that's great. Follow it to the next day, at least 2-3 days at a stretch, do this and you will feel better. But now if you belong to the category of degenerative issues, then obviously you need to see the Ayurvedic clinic and make sure you follow Ayurvedic treatments. Now these treatments are incorporated where you have to do a few therapies, you have to make sure you do the Tavili with the Pottani, and then you also follow Ayurvedic medicine. So there could be some Kashaya, there could be some Guli, but that is more to restore the circulation and make sure the cartilage is grown. In most cases we will adhere to applying a paste, so that is called the Pattu in Ayurvedic terms. Pattu is the one single-handedly responsible for nourishing and building your cartilage. Make no mistake, in Ayurveda we completely rebuild the cartilage, and this is how you get better, not through pain management. We don't have any pain management, and that is to the western side to manage your pain until you fully recover. Now what do you mean by fully recover? Fully recover means that you have absolutely no pain, you get along with your life as if there was no injury or no issue. You can further make sure that this is the case. So you have the onset of disease, the X-ray or the MRI that showing you the cartilages have issues, and then after 2-3 months of treatment you take another MRI or X-ray, then you can see that it's progressed, it's disease free. So this is in very briefly how we would take care of lower back pain. Now lower back pain can also manifest in your knees. So the patellofemoral joint, so ACL tear or the ligament, or it could be fluid retention in the back of the knee. So all these things are issues of degenerative in nature. So same treatment procedure, you need to make sure that every day in the evening you do the Tavili with the steamed herbal pouches, put the oil, in the night you have to put the paste, followed by Ayurvedic medicine. We will completely rebuild the knee. So you don't have to go under knee construction, knee surgery, or even draining your knee with, if it is excessive fluid retention in the back of the knee. So, I hope these things will give you confidence. Again, if you hit your knee, or if you are playing cricket and you fell and hit your knee and there is pain, you can apply some Narayana, Shulara or Sarshapadi, apply some heat, but just don't stop it on one day, follow it for the second day, follow it for the third day, and then that is home remedy for you to do. These days most of these oils are actually available in Sri Lankan shops. So, for that type of purpose that will be sufficient. So, you can do it and get better. Even if you have any other sort of joint pains, you can confidently apply and can feel better. But if it is any further than that, please you should see first you get an X-ray or an MRI, and then you can see the Ayurvedic doctor or Ayurvedic clinic, and we will make sure we will get you across. And that's it for the Ayurvedic segment today, and until we meet again, Ayubowan.